Hello, good day everyone. You're welcome back to my YouTube channel, Pharmaco Healthy Channel. My name is Pharmacist Goodluck, and in today's presentation, I have come again to address another eye-catching misconception that does not only exist among the general public, but also exists among a handful of healthcare providers. What misconception are we talking about this time around? We are talking about the misconception that diclofenac potassium is safer than diclofenac sodium when managing pain in hypertensive patients. This statement is inaccurate, and during the course of this presentation, it will become pellucid to you why diclofenac potassium is not in any way safer than diclofenac sodium when managing pain in hypertensive patients. Now, with this being said, we are going to delve into the presentation proper, but before we do that, I suggest we go for a little break. If this sounds interesting to you, I advise you to stay tuned. Don't go anywhere. Why? Because I'll be right back soon. Hello, you're welcome back from your short break. So the question now is, why is diclofenac potassium not safer than diclofenac sodium while managing pain in hypertensive patients? Okay, now recall that in the video we made about pharmaceutical salt, we had already established that the major difference that exists between diclofenac potassium and diclofenac sodium is that the former has a better aqueous solubility, which in turn improved drug dissolution rate, bioavailability, and drug onset of action. We also established that when it comes to the mechanism of action, both diclofenac potassium and diclofenac sodium share tantamount mechanism of action in management of pain. Hence, it has been recommended that diclofenac potassium, just like diclofenac sodium and every other NSAID, should be used with extreme caution when managing pain in hypertensive patients. This is because NSAIDs not just have the ability to precipitate onset of a new hypertension, but also have the capacity to exacerbate already existing hypertension. As a matter of fact, it has been recommended that any patient taking NSAID should be greatly monitored, not just during the initiation of the therapy, but also throughout the course of the treatment. But the most glaring question that is facing all of us is, do Nigerians really care? Permit me to say that most Nigerians actually doesn't care, and this could be the reason why there is increased rate of cardiovascular complications among Nigerians. This is also the reason why I, as a pharmacist, will advise you and will continue to advise you to always seek the consultation of your pharmacist or any other licensed healthcare provider before commencing any medication. That you were placed on a particular drug while you were sick does not necessarily mean that whenever you come down with similar symptoms again, you should walk into the pharmacy and purchase the exact medication, the exact brand, and start taking. No, it doesn't work that way. This is because before a patient is certified for a particular kind of medication, there are so many factors that are put in place. So it is very, very necessary that you consult a licensed healthcare provider before you start any medication. Now, having said this, we're now going to address how NSAIDs and by extension diclofenac, whether potassium or sodium, affects our blood pressure. NSAIDs generally affect our blood pressure by two major mechanisms. Number one, by antagonizing the effect of antihypertensive drugs. Yes, NSAIDs like ibuprofen antagonize the effect of certain antihypertensive drugs like the angiotensin converting enzyme inhibitors. Example is the lisinopril. The angiotensin receptor blockers. Example is losartan. And finally, the diuretics, particularly the thiazide and loop diuretics. These effects are usually seen when these two groups of drugs are taken together. The probability of seeing these effects tends to increase with age. This is because the tendency of making use of these two groups of medication, NSAIDs and antihypertensive drugs, tends to also increase with age. Why did I say this? I said this because both osteoarthritis and hypertension, which are the common conditions that requires the use of these two groups of drugs concomitantly, are age-related disorder. What does it mean? It means that there is high tendency that as one ages, one comes down with these two medical conditions that will now require the individual to start consuming these two groups of medications together. As a matter of fact, Research has shown that about 10 to 15% of elderly are concomitantly using NSAIDs and antihypertensive drugs in an attempt to relieve themselves from arthritis pain and at the same time control their blood pressure. Research has also proven that individuals taking NSAIDs tends to have increased risk of starting antihypertensive drug. This simply means that NSAID not only have the ability to counter the effects of antihypertensive drug, but also have a great tendency to precipitate hypertension. It is very important for me to also say that when it comes to the effect of NSAID on the cardiovascular function, different NSAIDs have different effects on the cardiovascular function. Some have higher tendency to precipitate hypertension, whereas others have higher tendency to precipitate stroke, and in that manner. Number 2, by damaging the renal function. Yes, research has shown that NSAIDs not just have the ability to cause renal dysfunction, but also have the capability to exacerbate pre-existing renal dysfunction. Yes, I am very much convinced that we all know how the kidney helps in regulating blood pressure. Yes, the kidney play an important role in regulating the blood pressure by ensuring that there is adequate blood volume. At any point when the kidney is no longer functioning properly, what happens is that there is sodium-ion retention in the blood. This sodium-ion retention now causes accumulation of fluid. The accumulation of fluid leads to increase in the blood volume, and this finally leads to increase in blood pressure. So what NSAID does is that NSAIDs target the cyclooxygenase enzymes, which does not only play important role in the renal tubular function, but also in renal hemodynamics, in ensuring that the kidney is functioning properly. So when it targets this enzyme, what occurs is that it inhibits the activities of these enzymes. And when the activities of this enzyme is inhibited, what happens is that the kidney is no longer functioning as it's supposed to function. And when this occurs, it leads to increase in blood pressure. So finally, why I said that diclofenac, whether sodium or potassium, should be used with extreme caution in hypertensive patients is not because it contains sodium or potassium. It is basically because diclofenac is an NSAID and will exert the effect of other NSAIDs. Now, I want to engage you. Follow me. Research has shown that 1 tablet of diclofenac sodium 50 mg contains about 23 mg of sodium ion. So if you consider a patient that is taking 150 mg of diclofenac sodium in a day, which 150 mg is in most cases the highest daily dose of this diclofenac, it means that this individual is consuming approximately 70 mg of sodium ion. Yes, now it is very simple. When we say 150 mg of diclofenac sodium, it simply means 3 tablets of the diclofenac sodium 50 mg. So when we say 3 multiplied by 23, we will be getting 69, and that is why I said approximately 70 mg. Research has shown that sodium ion itself is very indispensable in cardiovascular function and by extension general well-being of not just a normal individual without hypertension, but also for hypertensive patients. As a matter of fact, research has shown that a hypertensive patient requires about 1,500 to 2,300 mg of sodium ion on a daily basis for normal cardiovascular function. So for this patient taking 150 mg of diclofenac 50 mg, he is just taking less than 10% of the amount of sodium ion required when we take the lowest range, which is 1,500 mg. So he is simply consuming 70 mg. So when we now say 1,500 mg minus 70 mg, we'll be getting about 1,430 mg. This simply means that the patient taking these 3 tablets of diclofenac sodium still requires about 1,430 mg of sodium ion to reach the lowest range of the daily limit. So in conclusion, diclofenac potassium should be used with extreme care, just like diclofenac sodium and every other NSAID, in managing pain in a hypertensive patient. I would have said that NSAIDs should generally be avoided in managing pain in hypertensive patients. But due to the fact that NSAIDs in question are very indispensable in managing arthritis pain, even though our researchers are still working tirelessly, and we hope that in no distant time, a safer group of anti-inflammatory drugs for managing arthritis pain be discovered. But for now, it should be used with extreme caution. Having said this, I would like to say thank you very much for your audience. If you have not subscribed to my YouTube channel, you are doing me a great disfavor. Please, I beg you to subscribe to my YouTube channel, comment, like, and share to your loved one. See you in my next episode.